The nightmare care at the VA. Is this a preview of what ObamaCare will bring to the U.S.?
Going to work no matter how big anybody's heart is, no matter how much they care. Here is a microcosm of what Obamacare is going to be if it's fully implemented.
So is that just hyperbole, or is that our future? Hi, everybody. I'm David Asman. Welcome to Forbes on Fox. Let's go in focus with Steve Forbes, Rich Karlgaard, Sabrina Schaefer, John Tamny, Rick Unger, and Mike Ozanian. So Rich, was Rush on to something?
Rush is onto something. Rush understands something that big government liberals do not understand, and that is you can't demand something into existence. If you're going to increase the demand for health care, whether it's through the Veterans Administration or Obamacare, and you're not increasing the supply through technology and market incentives, then you're going to have one of two things. You're going to have unconscionable delays, or you're going to have prices going up. There's no way of avoiding the mathematics of this situation.
So, Rick, just like the VA, we're going to have fewer doctors treating a lot more people, and therefore government bureaucrats are going to come in to say what you can and cannot do.
Yeah, you know, Rush may be on something, but he's certainly not right about this. Look, I have hammered the Obama administration in everything I've written over the past 2 weeks. I think what's going on at the VA is unconscionable, the worst thing that we've got going on in this country.
But is it what we're going to see in Obamacare?
But it has nothing to do whatsoever. Simply because when I wrote a big check this week to my private insurance company, what was I writing that for if it has anything to do with the VA? Government is not providing health care in Obamacare. People seem to love to say that. They may have set some rules, agreed, but they do not provide health care.
Right,
government
Steve,
does provide it.
That's just not true, because Medicaid is expanding tremendously as a result of Obamacare. Medicaid is a government-run program. Obamacare can't have it both ways. They, on the one hand, say that Obamacare is spreading insurance to everybody, but on the other hand, they're including Medicaid numbers in that part of Obamacare.
Yeah, the government may not be running health care yet the way they run the VA, but they're telling doctors how to do their procedures. One size fits all. The Journal had an article the other day, an ophthalmologist didn't get paid because he didn't do the procedure, which saved a girl's sight, the way the Medicaid bureaucrats wanted it done. They're telling insurers what they can and cannot offer. So especially low-income people are getting very, very high deductibles, few choices of networks. So, yeah, we're going to VA land, just a slower route.
Mike, that article that Steve mentioned in the Wall Street Journal was heartbreaking. Very often surgeons will find on the operating table that they have to change procedures. This doctor realized to save this little girl's sight, he had to change a procedure, and he changed it in a way that he wasn't paid off by Medicaid. Now, he did the work, and she can see now maybe not all doctors would.
Yes, and the rules of the Affordable Health Care Act, David, are already causing premiums to skyrocket. Premiums for individual and small group rates are growing at their fastest clip in 3 years, between 11 and 12%. This is something that the president and Obamacare supporters assured us would never happen. Just like they said you can keep your doctor, premiums are going up just like they said they would not.
And obviously you can't keep your doctor, can't keep your hospital, but Sabrina, finding a specialist is going to be very difficult to do. In fact, in Canada, which is what we can sort of compare what we're going towards, look at this. After 4 weeks, only 39% of patients can get a specialist in Canada. 76% of us in the U.S. can right now, but maybe not in the future.
Right, and this is why I'm sorry, but Rick is in fantasy land here. Look, the VA system is the sort of platonic ideal for those who support Obamacare, the platonic ideal of government-run health care. But this is a perfect example of what happens when everyone has coverage, but no one has care. The reality is that we want the kind of system that's going to be good for men, for women, for veterans, for civilians, and that's a market-based system. That's a system that allows individuals to have choice and a market to respond to demand.
By the way, John, right now, Congresswoman Pelosi is suggesting that the fix for the VA is Obamacare. But in fact, isn't Obamacare an example of where we're going just like the VA did?
Oh, I think absolutely. I mean, for all of the military's virtues, it is a bureaucracy. It is not run by free markets. It's not run by price signals. So when you look at one of its health care programs, it's no surprise that it's marked by rationing and bad health care outcomes. In the case of Obamacare, undeniably the government is going to have a bigger role in how health care is apportioned. That's going to rob it of market signals. And because of that, we are going to see the VA writ large on the U.S. healthcare system. The lucky ones will get out of it.
Steve?
And, David, we're already starting to see it already in terms of rationing. You see it with mammograms. They're trying to deny it to women under 50, going to doom thousands of women to unnecessary deaths from breast cancer. So this process is already underway.
And, Rick, a fellow columnist of yours at Forbes magazine, Dr. Scott Gottlieb, who's a medical doctor, he worked for the Centers for Medicaid and Medicare, he compared Obamacare plans with private plans in the same area and found that cardiologists, OBGYNs, there are going to be far fewer specialists available for people who need them under Obamacare.
Well, so he says, and because that's a brand new article, I haven't had a chance to review it and maybe come up with something different. But I hardly know where to begin with the things that I've heard in this segment. Let me start with my good friend Mike here. No, premiums have not gone up their highest in 3 years. What has gone up is the total expenditure on health care. But what's fascinating is when it was coming down during the recessionary years, nobody was giving credit to Obamacare. It was about everything else. Now that it's going back up as people can join the system, it's Obamacare's fault. It's ridiculous.
Well,
in Fantasyland, Sabrina, show me how the VA is the same as Obamacare.
Mike, a lot of people, hold on a second, a lot of people, Mike, would say that the price was coming down from 2009 because of the recession. When people have less money in their pockets, they spend less on medical care. It's going up now with the implementation of Obamacare.
That's right. And the survey, sorry, Rick, you had your chance. Morgan Stanley, who did the survey, when they asked the question, the insurers said that it's the rules, such as how they can structure prices and so forth, that are specifically leading to the price increases. And look, David, when you have Senator Harry Reid taking to the Senate floor to say that the people that are complaining about the service under Obamacare are liars, that's when you really know.
Well, yeah, Jay Rockefeller saying the people who were talking about Obamacare are racist.
They can't defend it with numbers, so they're throwing out names. That really is despicable.
Sabrina, go ahead.
Yeah, I mean, it's not rocket science either. When you provide something for free for everyone, it simply can't work, right? We're going to have longer lines. We're going to have corruption. We're going to have ration care. I was at the pediatrician with one of my children yesterday. I said, wow, my throat really hurts too. He said, I'd love to check you out. I'd love to do better medicine, but I can't because I don't have a chart for you. I don't have a way of billing, the insurance company. This is all going to get worse, was his point. This is all, he's going to be squeezed even tighter. There's going to be fewer people who are going to go into the medical field because of this.
Rich
There's going to be a whole lot of losses.
Go ahead, Rich.
Rick Unger's right on the technical differences between the VA and Obamacare, but the fundamental economics, as Sabrina and the others on this panel have pointed out, is exactly the same. When you increase demand, but you haven't increased supply, in fact, you're shrinking supply, making it more difficult for doctors to practice, then only one of two things can happen. Prices are going to go up or they're going to be delays due to rationing.
And John Tamny, again, we're already having that. As that doctor in the Wall Street Journal pointed out, he had to go outside of the system. He was not paid back by Medicaid for saving this little girl's sight. Some doctors on the operating table might say, geez, if I'm going to have to eat, I can't afford to eat the costs of this operation. Luckily, that doctor could.
Absolutely. I mean, the problem with government getting involved in healthcare is they're actually trying to bring prices down. But the simple truth is you want prices to reach their natural market level so that you get more doctors pursuing ways to cure patients. The problem with this system is that when you force prices down like this, you get scarcity, and you will see the VA across the national healthcare system.
Rick, go ahead. Final word.
Sabrina, you can correct me if I'm wrong, but I'm going to bet that you do not have an Obamacare exchange policy, number one. Number two, I know you're not on Medicare, so if your doctor had to check a chart, it's because that's what your private insurance company's making him do. The real rationers of health care.
Yeah, ask a question. Go ahead, Sabrina, very quickly, please.
The point is it's going to get worse. There's going to be more ration care, more restrictions on doctors, and the prices are going to go high. Coverage does not equal care.
And I know you're not on Medicare. I know that for a fact, correct? We could all be sure of that. Ladies and gentlemen, thank you very much. Coming up next.